Hi, Matthew Holt with a THCB Spotlight. This time I am with Sophia Yen, who is the Chief Medical Officer and founder of Pandia Health. Sophia is an OBGYN who has been incredibly outspoken and upfront about talking about contraception, women's health, reproductive health, and now menopause, and a number of other things, and has been working with Pandia Health for, I don't know, how long have I known you? 8 years, 10 years, something, a long time.
You got it. 8 years.
Eight
Spot
years.
on.
That was a good lucky guess. So, Sophia, first up, for those who don't know, there's been obviously a lot of back and forth about reproductive health, contraception, IVF, God knows what else. But there's also a number of companies like yours who are essentially online pharmacies plus plus. Um, tell me, tell the people what Pandia Health does. What does Pandia Health do?
Pandia Health is the online asynchronous women's health clinic for hormones, from birth control to menopause and more. We're here to supplement your primary care physician in areas that they don't have the expertise. So if you need a prescription for birth control, our expert doctors can write the prescription. And then if you just need delivery, if you have the prescription from your provider and insurance, you pay us nothing. And our whole goal there is no one runs out of birth control on our watch. And for menopause, we like to write the prescription and do the delivery. So that's what we're doing. And we've also thrown in acne.
All right. So, in this wider space, right, there is hims and hers. There's Ro and I forget Romanji. I forget what people. There's been people in and out over the history, like the Pill Club, Lemonade, which made part of 23andMe, and if they're still doing the same thing. Give me a sense of the sort of presence of online physician plus pharmacy in contraception as a whole. How many people are using this compared to going to their regular OB and getting stuff at CBS? Give me a flavor of how big a deal it is.
I would say that it's still an underutilized market to use an online provider to write your prescription. For delivery, the mail order, last time we checked, was only 10%, but I believe it's probably up to 20% of people. But 80% of people are still going to the pharmacy every month to go get their birth control medication. And that is one of the sole reasons I made this company. One of the top reasons why people don't take their birth control is, oops, didn't have time to go to the pharmacy, didn't want to deal with the insurance. If you go on 8 days before the medication runs out, the insurance is like, you have to come back tomorrow. And you're like, I don't have time. I have a meeting tomorrow. I have children. I have work. I can't. I'm here. Please give it to me now. And they're like, sorry, that is the way of the PBM or the pharmacy that won't pay for it because their computer only allows 7 days in advance. So I'd say a ton of people still see their primary care doctor to renew their birth control prescriptions. They don't realize you can do that online with experts. And what distinguishes Pandia Health is we've come up with an algorithm that better chooses the first birth control pill for somebody new to the birth control pill or somebody who's been having issues with side effects and whatnot. Our patients at 10-week follow-up, 94% are like, I like what you gave me. Let's continue with it. Versus the standard is about 33 to 55% of people are still on their new birth control pill at a year, compared to we actually have 82% of our people on it at a year because we're able to pick one that they like, one with the fewest amount of side effects. And I came up with this as an academic physician, as a woman of color, realizing what we're teaching in the medical schools. Great. If you're a Caucasian female that wants to bleed every month, but if you're not a Caucasian female that wants to bleed every month, you don't want to bleed every month, then we have the algorithm. We've trained all of our 100% physician team to pick the best first birth control for women.
So that's great. Give me the wider things. I've heard you talk about this before, and I just about so there is birth control, right? And there's also the morning after pill and other things like that, or the same effect. Give me and there's obviously a wide range of contraception that I'm sure the average white male like me doesn't know about, and frankly, probably not enough people know about. So give me the sort of range, and then which parts of the range do you recommend, and how do you deal with this as a whole?
Yeah. So to give the wide range of birth control options out there, I like to say, if you ask us what's the best birth control out there, the best hormonal or birth control overall is the implant. The implant beats vasectomy. And whenever I look at that, I'm like,
Right.
Whoa, that's so crazy. Then comes the hormonal IUD, then comes tubal ligation. So the fact that a hormonal IUD beats snip, snip, burn, take out an inch on each side is like, oh.
Wow.
Again,
That is incredible. So hang on. Tubal ligation is not guaranteed.
is
But
not as effective, and
right.
vasectomy is not as effective as
That's because my
implants.
cowardly men lie about it. Say, yeah, I went and had a vasectomy. And
No, it's not about that. It's the body wants to reproduce that much, it reconnects or something. Like, that's just like so great. Or poor technique on the surgeon. I don't know. But the fact that the implant and the hormonal IUD beat that. We are an asynchronous online telemedicine clinic, so we cannot provide the IUD or the implant, but we can provide the pill, the patch, the vaginal ring. There are two different vaginal rings. A lot of people don't know this. One, you just stick it there, leave the entire year. If you enjoy bleeding, you can take it out every 3 weeks and bleed for a week and put it in. But if it were me, my daughter, my friend, my patient, I'd be like, why bother? And there's a monthly one. And so we do the pill, the patch, the ring. During the epidemic, we did Depo-Provera subcutaneously. We still can do that if you are confident injecting yourself, have medical experience, or have a family member. Mainly it's nurses that, want this at home or something like that. Generally, I don't like that method because it gives you the munchies and weird periods, but each person to their own. Those are all of the contraceptive options. Certainly, there are condoms. We don't offer condoms yet, though I have my signature condom bag that I carry around to have conversations. Let me grab it to show the condom bag. It starts conversations in airports as I walk around doing groceries, etc. Anyway, the one that you alluded to is emergency contraception. So it's
Right.
really important that people understand that emergency contraception is not medication abortion. The two came out together. So a lot of people get them confused, or just people don't, you're not doctors, you don't understand everything. So emergency contraception is, oh my goodness, the condom popped. I wasn't using anything else. You have up to 5 days to use any of these four methods. And a lot of physicians don't know all the four methods. So the number one most effective method is the copper IUD. 99.99999% effective as emergency contraception. And if you go to an ER, if they have a family practice physician, or if they can call in an OB-GYN, so any academic ER can call in an OB-GYN and be like, throw down a copper IUD, and it's 99.99999% effective. The hormone
Does the copper IUD stay there and then become a regular IUD for the rest of the time, or as long as you want? So
exactly.
basically, putting an IUD in is an emergency contraception, but you could
Yes.
put it anyway, as you mentioned. All right.
Yes, you could leave it. And I like to say, who better to leave a long-term, long-acting reversible contraceptive than somebody who had oopsie? You
Yeah.
have one oopsie, you might have another oopsie. And then next is the hormonal IUD, which has been shown in a New England Journal of Medicine article. And oh, wow, I think it's 2020. So it's 4 years now, or maybe 2022, to be effective. And it only has a failure rate of 3 out of 313, I believe. So that's huge. And then next comes prescription emergency contraception. So at Pandia Health, we're like, which emergency contraception would you like? We suggest the prescription emergency contraception because under the Affordable Care Act, thanks to Obama Biden, any FDA approved birth control, no copay, no deductible if you have insurance, be it private or public. So I think that's one. But two, it works up to 5 days. It works better at every single time point. It beats the over-the-counter option, and it works up to a body mass index of 35. With Plan B and the other generic over-the-counter emergency contraceptions, if your BMI is 26 or greater, and mine's like 25, 26 if I eat extra cookies or dessert, if it's 26 or greater, doesn't work so well. If it's 30 or greater, does not work at all. And about 66% of the US population fits in that BMI of 26
Yeah.
or greater.
Yeah.
So important for people to check their BMI before you buy or use emergency contraception, because there's no point taking it if your BMI is 30 or greater for the over-the-counter.
Well, so just to restate, Plan B does not work if you are clinically obese at 30 BMI, which is
Yes.
a lot of people.
Yes.
And
Yes, at least a third of the
yeah,
population.
absolutely. I mean, on the way to half. Anyway, I mean, including me. Not that emergency contraception is something I particularly need, but nonetheless, it's not rare. That's incredible. So you are so from Pandia, you can get the emergency contraception. You will. How do you
Yes.
get it there in time?
Yeah, so we can either call it into your local pharmacy or we can ship it overnight for extra fee.
Okay.
We generally recommend anybody who's on the pill, patch, ring, or condoms to have a pack of emergency contraception for future use. And so we
Yep.
actually write on the prescription, and you can tell your doctor to do the same. Please give the patient the one with the farthest expiration date. Or if
Right.
you walk into the pharmacy, be like, hey, this one expires tomorrow. Please give me the one that expires 2 years from now because I'm preparing for future. I like to think of it like a fire extinguisher sitting in the corner in case of emergency. Anybody with a teenager, any, reproductive age young person in your house, I have a drawer of condoms and a pack of prescription emergency contraception.
Absolutely. Probably more effective than the traditional American approach of having a shotgun. But okay. Um, so that I assume is we've just done the majority of what you're known for in the business. So tell me a bit about what else you're doing. Tell me a bit about the menopause treatments that you're offering.
Yeah. So, one of the reasons we went into menopause is we had a bunch of 50, 51, 52-year-old women who were using us for birth control, but I really think they were using us for hormonal replacement therapy. And then I hit menopause, and all my friends like, menopause. And I'm like, yes, I will find the best treatment for me, and I will share it with you. And so this company has served me through my birth control years and is now serving me through my menopause years. What I want listeners to know, if you don't already know, there are only approximately 2,000 Menopause Society certified practitioners, doctors and practitioners who have taken a test to say they know their menopause stuff. And certainly an OB-GYN, internal medicine, family practice doctor could do it, but if they haven't read up on the latest and greatest, they may not know it is no longer the standard to give the lowest dose of estrogen for the shortest amount of time. If you talk to most Menopause Society certified practitioners, we personally are on the patch and we personally are saying, you're going to have to pry this out of my dead hands. And so I think the menopause market is underestimated. They're all estimating 10 years on this. If it starts at 52, which is the average age of menopause, I'm not done by 62. I intend to be here till 80, and I personally want to live to 100, 120. I'm one of those biohackers, you know? So absolutely the market's underestimated. And the gold standard treatment is the estrogen patch because it has a decreased risk of blood clot compared to an oral estrogen, and then bioidentical progesterone pills. You can take it either 14 days out of 28, which you might have some cycling and some bleeding or not. And then, or you can take it every single day if you want to just avoid the bleeding situation. And there are different dosages of the estrogen, but that beats any supplement, any non-estrogen treatment. There are non-estrogen treatments if you have a contraindication to estrogen, such as breast cancer or something like that. And then there's also vaginal estrogen, which there is no contraindication to pretty much, even if you've had breast cancer, because the vaginal topical estrogen is only here. It doesn't go systemically, and so it does not increase your risk of cancer elsewhere.
What? So clearly, menopause treatment as a whole got really screwed up by the whole HRT
Yeah.
controversy, which was now nearly 30 years ago, as we discussed earlier. And how close to sort of coming back to where we were then are we now in terms of getting the right treatment, the scientifically valid treatment that actually helps the most women, or is it still a huge problem?
I would say it is still underserved. Like I said, 2,000 practitioners for the entire country. When I graduated med school, which was 30 years ago, we were taught this for menopause treatment. Put your hand on the woman's shoulder and go, this will pass. And I was like, I thought menopause was a day, and it is technically a day, the day of your last period. And you only know this 12 months later. So for all those without uteruses, know that we get a period. I'm like, oh, is this it? Is it? Am I done? Am I done? And then 3 to 6 months later, bam, and you're like, oh man, I gotta reset the clock, like, and meanwhile your hormones like blah. and you don't want that. So I personally believe those of us that are on the pill, patch, ring, IUD, implant, shot, hormonal birth control going into menopause are going to have a much smoother ride because we're already on HRT. And then when you hit 52, 53, be like, am I there yet? And if you're there, then just transition to HRT. But we still lack the funding to have enough research for all this. But the other part is I can't wait until they have the research. By the time they have the research, I'll have my dementia or I'll have my heart attack because it's going to take 10 years to follow and see. And we don't have all that data yet.
Okay, so plenty to be done there, but at least we've kind of we're back on the right track. Even there's a lot of opportunity and a lot of problems, and therefore a lot of opportunity. Let's switch gears a little bit. You're currently prescribing. You're licensed in 15 states, or Pandia's
Yes.
licensed in 15 states.
Yes.
I don't know how are you set up with MDs and MPs on. I mean, what's your medical group, quote unquote?
We have Pandia Medical Group, and it is 100% physicians. That's all we use. We have patient care advisors who are customer service, but any medical question you have is sent to a physician. We like our asynchronous platform because I realize it's actually unlimited time. You type as much as you want, and my doctor will type back as much as they want. Whereas the synchronous ones, it's scheduling. You got to find a time that both of you can meet. And it's kind of like Kaiser, where it's every 15 minutes. I'm sorry, I have to go. I'm sorry, I have to go see the next patient. I'm sorry, I have to go. Whereas our system, you have a question, we answer. You have a question, we answer. You want to write on paragraphs, our doctors will read paragraphs, and our doctor will respond accordingly. And the 15 states we chose was biggest bang for buck because it costs the same legal, accounting, etc. wise to open up Alaska as it does Texas. And so we chose the biggest states: California, Texas, Florida, Nevada, New York, so that also the ones you might visit. We encourage birth control and menopause tourism. So if you're flying through Vegas or flying through SFO or New York or Florida, any of the Disneys, you can be like, I'm in Vegas right now filling out the questionnaire. And as long as you were in Vegas at the time you filled out the questionnaire, our physician can write the prescription. And then our partner pharmacies, we have Pandia Pharmacy and other partner pharmacies, can deliver to all 50 states. And we can bill your insurance for the birth control, again, under the Affordable Care Act, no copay, no deductible. Menopause, unfortunately, not the same. Generally $30 a month to 60 to 100, depending on what your copays are for your insurance for menopause.
Okay, so let's talk about some of those states, and let's talk about the thing that's changed a lot since we last talked, which obviously is the Dobbs decision. Now that abortion is basically effectively legal in many of those large states, especially obviously Texas and Florida, the big two. Although who knows what will happen with the Florida? Well, let's cross our fingers as to some sense coming for the Florida amendment ballot measure that's coming this fall. But anyway, we know that currently. Medical abortion is sorry, not medical abortion. Surgical abortion is illegal there. What's the current status of medication abortion in those states, and then you're an advocate, but what's Pandia's role? So let's sort of separate out. First off, what is the current status? I know that the Supreme Court did allow mifepristone,
Yes.
which at one point was going to be banned, but what's the current status or sort of state of play for women trying to get medication abortions? How are they getting them? And then what's the role of Pandia in that at all?
So the rules regarding abortion are the same whether they are surgical or medication abortion. So if in your state you have a 6-week ban, looking at you, Texas, and potentially Georgia as well, then that applies to both medication and surgical abortion. So, but theoretically, there's a window. So as soon as you miss that period, start looking for what you need to get done. Some people say actually get the medication abortion, which is the medication in your hand. It's $150 for a telemedicine medication abortion, and you can get the drugs in advance. And just like emergency contraception, it could sit there for 2 years. And so I advise people in any of these restrictive states, every group of 20 friends get together and be like, all right, let's each pay $8 and invest in this, and we'll have, this medication abortion. If any of us need it, as soon as your period's gone, here it is, ring on my doorbell, come get it. Okay. And so the website that is a nonprofit that gives you information on places they've tested to make sure it's safe telemedicine, mainly within the United States, drugs coming from India so that no one in the US loses their license, gets sued, or whatever. And therefore, you need a 2 week lead time sometimes to get it, but they may have faster options. PlanCpills.org, nonprofit run by a friend of mine, love her. And she has a listing for every state. So there is a woman called Dr. Gompertz from the Netherlands, and she'll write the prescription from the Netherlands, ship it from India so that nobody goes to jail, nobody loses their license. And therefore, that is available to all 50 states. The legal side for you on that website, they have a legal hotline and they warm line, and they have a medical warm line. But also when you pay for it, whatever telemedicine service you choose, that person is legally responsible for you on the medical side. So if you have any medical questions, but they also have a medical warm line that is answered by, I believe, either Physicians for Reproductive Health or Medical Students for Choice or one of those organizations. So
All right.
that is the way you can access it. Pandia Health has been asked by many investors, many women, many reproductive rights people to go into medication abortion. But unfortunately, we cannot touch that with a 10-foot pole, because if I lose my license in Texas or Florida because they go insane or something like that and get crazy and come after me for medication abortion, then we take down all 15 states. So we cannot risk that. And so our role is preventing unplanned pregnancy, because about 50% of US pregnancies are unplanned.
Sure.
And then the other part is adherence. Women were on birth control, but they didn't take it. And so giving you the pill, the patch, the ring, encouraging long-acting reversible contraceptives, preventing the need, and giving you emergency contraception. And so if you did miss 3 pills in a row, then quickly take some emergency contraception. Or if you ran out, at least you had the emergency contraception that didn't expire for 2 years that you could use it.
Yeah, I understand that at least Hey Jane is a US-based company that is delivering abortion pills. They've presumably either taken a different risk profile of this
They're not going to any states where it's illegal.
Okay. So you could, so even if, so you, so they're the same thing. You have to go to Nevada or wherever and call in, even though you happen to be in Georgia. I get it. So so it doesn't actually help you with this,
Much. But I absolutely applaud them.
yeah, absolutely. Fantastic. Well, look, I mean, that's obviously that's a moving target. I wrote a piece about, healthcare under the Harris administration, fingers crossed, in putting our things out there in next year. And I said the problem is, that's the main thing they need to do, which obviously will require either massive change in the Senate, breaking the filibuster, changing the Supreme Court, doing something. And then even if we get it all done, we're only back to where we were in 2022. It's not like it's a massive advance in women's health. It's repairing the dam that
damage,
rebuilding the damage that was done, or the dam that was broken, or whatever you want to call. So that's where we are. And we're still in the situation, as you said, where there is incredible lack of awareness and incredible lack of, as I said, 50% of pregnancies being unplanned means that we're not getting through. We're not getting through, and there's a whole downstream, or is it upstream, effect on lack of things that you've been working on for years, like sex education and and awareness of, which was why I had you trot out all those things, because I guarantee you, and no matter how smart and healthcare the audience are who's watching this, they don't know. No one knows this, right? And they don't get taught it properly in school. And even if they went to medical school, they probably forgot that class or were asleep at the back or what have you, and only you were paying attention. So let's wrap with the company. You've been around 8 years. You have a relatively new CEO. You stepped down from the CEO role and became the chief medical officer. Tell me about you raised some money a while back. Give me a sort of sense of where the company is as a business.
Yes, we are currently up to about 18,000 customers. And as I mentioned, we can write the prescription in 15 states. We can deliver to all 50. We have Open Pandia Pharmacy, which currently can do about 26 states, and they will be up and running in more states by the end of the year. Pandia Health is expanding as we are raising more funds, and we're always raising funds. So anybody come our way that might be interested in that way. We started with birth control, we added acne, we added menopause. We have menopause 1.0, which is just the medication treatment, but we can see in the future adding video for those people who want to upsell, because it costs more money, takes more time to do a one-on-one video situation. And then nutrition counseling, exercise, community, absolutely can add that as we go along. But really, we're not here to be primary care. We're not here to steal patients from your primary care doctor. We're just here to offer expertise in areas your doctor doesn't have, which is our algorithm for birth control and our Menopause Society certified practitioners. Oh, I forgot to mention, we have 5 of the 2,000. And that is a huge percentage of the Menopause Society certified practitioners, and we're getting more. But also that our two that are leading our team are OB-GYNs with 20 plus years experience in treating menopause, which is very different from somebody who just took the test in June or who's going to be taking the test in October.
All right, couple of questions actually on that, and one I forgot, which was that a while back some states were demanding a video visit as part of the asynchronous, instead of in addition to an asynchronous conversation around prescribing. Is that still the case, or have you
That
had to
is
steer clear of them?
absolutely the case. We've had to pull out of, I'm looking at you, Tennessee and Alabama and Washington State, because unfortunately, it's not the state. Sometimes it's the medical board that
Yeah.
says, as a physician, you cannot prescribe unless you have a video. But I want to argue back that having a video would not change my practice or treatment of the patient for birth control, menopause, acne. It just increased the cost and therefore a barrier to access. We're able to make our birth control $30 once a year to use our expert doctor with unlimited follow-up questions because we don't have a video. As you can tell, I run yappy and I can't cut my patients off. It's just rude. And the menopause, same thing. You can talk as much as you want and then I'll read it and I'll summarize. But if I get on a video with you, I could be on there for 3 hours. And at our doctor's time, we can't afford to charge you. We're charging $130 for the initial visit, 60 per follow-up, and we're rolling it into a subscription pricing right now, which will be lower on average per month. So it just jacks up the cost, doesn't improve care. And so if you want to improve access, we have an algorithm to birth control that no one else has. And unfortunately, Washington, you can't have it because you have this video requirement. And there's 10 other states. And that's why we encourage birth control and menopause tourism for those other states.
Yeah, there's a lot of problems with regulations and rules around telehealth, and the fact that we have different rules for different states is bonkers. There is actually a lawsuit going on around some cancer care between Massachusetts and Connecticut at the moment, which hopefully resolves some stuff. But also you've got the issue around controlled substances and
Yeah.
can you use telehealth at all and stuff. And really the laws surrounding this is so backwards compared to where the technology is that it's just bad.
It hasn't kept up.
I don't know.
And one thing I do want to share with you is there's the Reproductive Freedom Alliance, which is an alliance of 26 governors that support reproductive rights and are looking for policies to be proactive on reproductive rights. And so I've proposed to them that we should on a national level, and I'm hoping Harris, if she is the first president of menopausal age and menopausal experience, would pass no copay, no deductible for any FDA approved treatment for menopause. Just
You do
seems
tend
the
to think
right
it,
thing
it
to
is
do.
it is something something that the hospital population will go through, right? So it's one of those things, and frankly, we had the similar thing with the vaccinations in the pandemic. Although apparently now it's no longer an emergency if you don't have insurance, it's free. But if you don't have insurance, now you have to pay for it. So we'll hard enough to get people to take their COVID vaccinations as it is. So things are not always going in the right direction. Finally, I know you have a fund that you want to talk about.
Yes, so Pandia Health from the beginning has always been about helping others. And if you can't afford our services, we have Pandia Health Birth Control Fund. Only for the birth control, sorry, not menopause. Menopause is very expensive and would eat the entire fund. But if you cannot afford $30 once a year to use our physicians, or roughly $17 per month for a pack of birth control pills, then you can apply to the Pandia Health Birth Control Fund. There's a apply at the bottom of that page. It's pandiahealth.com/social good is the tag, but you can find it at the bottom. And if you have money to donate, please donate. It's a tax deductible C3 tax deduction. And we also believe in give a penny, take a penny. So if you can't afford it now, we cover you. Please pay it back later or pay money now in case you might need it in the future, but just do a good thing.
Fantastic. All right, brilliant. I've been talking with Dr. Sophia Yen. She is the Chief Medical Officer of Pandia Health and has been a I was gonna, well, you're a warrior for the cause of women's health in general, health in general, but women's because it does impact men as well. I understand that there's some connection between women and men. One day I'll find out what it is. For many years, and go take a look at pandiahealth.com. Sophia, thanks for your time.
Thank you for having me.